I'd like to acknowledge the traditional owners, custodians on the land in which we're meeting today, and I pay my respects to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people who might be with us on the call today. I'd like to extend a warm welcome to Simone Sheridan. Simone is a sexual health nurse consultant at Austin Health here in Melbourne, where she provides support for people who are experiencing changes to sex and intimacy as a result of illness or injury. Simone also facilitates education for healthcare staff on this important but often avoided topic. The topic for today is sex, intimacy, and cancer, talking about sex and intimacy concerns in the context of cancer treatment can feel challenging. Problems may arise as a result of changes caused by treatment or side effects of medication, but many people can feel unsure about where to turn to for help. This session will include impacts of cancer and cancer treatments on sex and intimacy, communication techniques to bring up the topic with partners, and how to seek help from health professionals, as well as resources and other supports available. So thank you, Simone.
Thank you very much. So you happy if I share my screen now then?
Yes, thank you.
Great. Okay. Fantastic. Yes, so welcome to this session on sexuality, intimacy, and cancer. Thank you for that lovely introduction. My name's Simone and I'm the sexual health nurse consultant at the Austin. And like that was said, my job at the Austin is to talk with patients and clients who are experiencing changes to their body and to the way that their body responds sexually, that sexual response system, their arousal, libido, erections, lubrication, everything under the umbrella of sexuality and intimacy, and particularly how that's been impacted by the treatments that they're having. So this is something that I've been doing for many years and I'm very passionate about, and I'm really happy to be here today to share with you some ideas and tips and some information so that you can be better informed about this important issue. So I'm coming to you today from Wurundjeri country, and I too want to pay my respects to elders past and present, and remember that this land always was and always will be Aboriginal land. So what we're going to cover today in this roughly half an hour session is to take a really broad view of sexuality and sex. So we're going to step back from that idea that sex is just one activity. We're going to talk about why it's important that we talk about this topic in healthcare, and often why we don't, the barriers to talking about it. And we're going to touch on some of the challenges of cancer treatment and survivorships on sexual health and intimacy. I'm not going to go into too much detail about specific impacts from particular treatments, but talk more generally so this can be applicable to lots of different people. But happy to answer any questions at the end or any questions that come through after the session as well. And I'd like to leave you today with some really practical tools and resources so you can find out some more. I just want to start though by acknowledging that not everyone's sexual experiences are positive. And for many of us, we've had experiences in the past that have been really difficult and challenging. And there's lots of supports out there as well. And particularly, I just want to let you know about the great phone line support, 1-800-RESPECT, for anyone who's experienced sexual or domestic or family violence, as well as Northern CASA, which is an organisation that provides free counselling for anyone impacted by sexual violence. And that could have been at any point in their life as well. So those supports are great because they give us a chance to talk about the, sex and intimacy when it's been really difficult or violent or problematic. Okay, so putting that aside now, we're gonna have a little bit of a fun discussion about sex and intimacy. And the first thing I want to touch on is that it's quite an obvious statement, but sex is not just about making babies. I mean, babies are very cute and very important. We all wouldn't be here if sex wasn't about making babies, but it's not just about making babies. And often when we're talking about sex and intimacy in terms of cancer, health professionals are very happy to have conversations about fertility, and fertility preservation has become really a cornerstone in cancer care to make sure that everyone has that option. But sexuality and sex and intimacy is so much broader than that. And the World Health Organization takes a very broad view of sexual health, encompassing respect and pleasure and safety, and this broad idea of emotional, mental, and social well-being. And it really centers sexual well-being as a central component of quality of life and a really important aspect of being human. And when we talk about sexuality, sometimes we can think of our sexuality in quite a narrow form, and we think, oh, it just means if I'm gay or bi or straight, but actually our sexuality is so much more than that. It's really diverse and personal, and it becomes an important part of how we see ourselves, how we express ourselves, includes our sexual feelings and our thoughts and our attractions and behaviors towards others. We all have a sexuality, and that sexuality is really important to be honoured and respected. We know, though, that for many people who have diverse sexualities, there can be additional barriers to seeking help, particularly when it comes to specialist services. And so the Cancer Council have designed a really great booklet that's just been launched. I think it was just end of last year, to support people of diverse sexualities and genders in accessing services and getting good information. But as well, on top of that, a lot of organisations now, like the Austin, are actually being really visible in their support of diverse sexualities and genders. So I just wanted to bring that up, given that we're talking about sex and the diversity of sex and how that plays out in our lives. We're making sure that this session is definitely inclusive of everyone, that everyone is welcome here. So if I threw you this question, and I'm not going to actually ask you in person, but have a little think for yourself, what is sex? If someone asked me this question, what is sex? What does that mean to me? You know, sometimes it's a really hard thing for us to answer. And for many people, the answers can be quite different. But actually, when we think about, well, what does it include? It often includes a level of excitement. That can be a physical excitement or arousal that happens, that there's pleasure involved. And often an outcome of sex is that it improves connection. And that might be with a partner or partners, and or it might be with our sense of self as well. I think it's really important to make sure that we know that sex is not limited to intercourse, and it's never a should or a have to. Like we saw before with that World Health Organization definition, it's really about that pleasure and respect and safety as well. So we need to have a much more expansive definition of sex if we're going to do well across our lifespan. This more expansive definition, where we're thinking broader than this one ultimate activity, is much more inclusive for people with different bodies and changes to their bodies as well. And it actually promotes us all to have much more satisfying experiences across our lifespan. And I really like this book that's on, I've got a picture of there that says Sex is a Funny Word. It's a book for young primary school children. And it's really kind of, if you read this book, there is nothing in there about this idea of sex is one activity, but much more this idea that sex can be many different activities. And I think this is a beautiful way to kind of promote these satisfying experiences. Someone once said this great quote to me, and I found this image which I thought kind of exemplified it beautifully, that if we just think about sex as a single item on the menu, then we're really missing out on that whole buffet of experiences and the whole diversity of experiences that we might be able to have. Now, we know that sex is an important part of quality of life, and that we are all sexual beings from the time we're born until the time we die. But how we express that changes across our lifespan, and it changes because of aging, it changes because of illness or injury or disability. But at the core of this, there is a really important part of us, our sexual selves, that's there right across our lifespan. Unfortunately, though, the bad news is that when we look at cancer therapies, including chemo, hormonal immunotherapies, radiation surgeries, all of these types of therapies, they do have the potential to impair sexual function. And this is, I guess, it's a really sad fact of what we're facing. And it's for many different reasons, but I think it's worth acknowledging that the treatments that people go through when they have cancer do have the potential to impact this part of ourselves. And that's why it's so important that we talk about this in healthcare. So these are some of the sexual problems that might arise after cancer treatment. They can be a really diverse range of problems that arise, but here are just some of them. So it might be to do with someone's libido or their sexual desire changing. There can be vaginal dryness, erectile dysfunction, changes to someone's ejaculation. There can be a change in sensitivity of erogenous tissue. So that's the tissue that makes people feel sexually aroused. It might be the genitals or the nipples or other parts of the body. And sometimes cancer treatment can make those areas less sensitive. People might have difficulties reaching orgasm, and for some people there might be something we call dyspareunia, which is a painful intercourse that arises as well. But there are so many different factors that play into what causes these changes. So for some people, there's an element of pain and fatigue that really play into these impacts. Medications and clinical conditions can have significant impacts as well. And in the background, as we're aging, our bodies are changing as well. But on top of that, there are some societal expectations. You know, I think sometimes we don't see cancer as very sexy, and that can change how we feel about ourselves and about other people as well. There's actually a lack of knowledge. Not a lot of people know about the changes that are happening and what they can do about it. And we know that cancer treatment can also sometimes be associated with depression and anxiety, and relationship difficulties, and all of these fears and worries that play into how our bodies respond. Because our sexual response system is not just a physical response system, but it's influenced really heavily by what's going on in our brain. We often talk about our brain as our biggest sexual organ, and when it's being impacted by lots of things that are happening in our lives, it can really impact the ways that our bodies respond sexually. So these are some of the things that might be going through people's minds after cancer treatment. There can be feelings about not being desirable anymore, worries about what if things don't work, what if there's been changes, what if it hurts. And we start to really kind of, get a bit burdened down by these thoughts of rejections and changes and what's going to happen. And there can be lots of emotions that accompany this. Sadness that things have changed so much and it's not what it was before. Guilt, sometimes because we feel like we should be doing something better, or we should be able to be there for our partner in a certain way. And sometimes there can also be anger that, why is this happening to me? And this is another thing that's changed, or that I've lost as a result of this cancer treatment. And unfortunately, all of these thoughts and worries can mean that we lead to avoidance, that we think, actually, I'm just going to push that over here to the side and I'm not going to deal with that right now. And I don't even want to think or talk about it. And I guess that's why I want to be here today, to kind of raise this topic so we can start talking about and finding some solutions to some of these problems. And the first thing that I want to remind people of is that there are so many benefits to sexual activity. And we're not talking just here about one particular sexual act, but we're talking about a broad range of activities. So these are some of the benefits that we know we've been seen in our research, in our literature as well. It's great at improving our sleep. It counts as exercise. It creates intimacy and connection and a sense of well-being. It's pretty fun, and that's really nice for us. It can improve our blood pressure. It can act as a pain relief. So many benefits such as this. And there was a doctor that I worked with once who used to say, if sex was a pill, we'd prescribe it to everyone. So I think that's a really nice way to kind of summarize that, when we push this thing off to the side and I'm not going to deal with it, we're actually maybe missing out on a whole lot of positive things that could be happening in our life if we were able to get some help and support with that. And the thing is, knowledge is power. This is some advice from the Cancer Council of Victoria that I love. They suggest that you gather as many facts as you can about the effects of your illness and its treatments on your sexuality. The more you know, the more you're going to be able to help work out what's going to be best for you. Unfortunately, though, I can imagine from, people listening to this today, and from the point of view of healthcare professionals, there are so many barriers to talking about sex. A big one is embarrassment. Embarrassment on both sides. I talk to lots of health professionals and try and encourage them to bring up this topic with patients, but they're scared of embarrassing people as well. And there's other barriers to speaking about sex with healthcare professionals. There's assumptions. Is it okay to talk with this person about this? They're younger or older than me. I don't know if that's okay. I don't even know what words I can use to ask people about this question. Oh, they seem really busy, and it's not really private here at the moment. Is this something where I feel safe to do this? And, I'm worried about causing offense, and asking this in the wrong way as well. So this is coming from both sides. So it's a really difficult topic to talk about. But this is something that I'm very passionate about supporting people accessing healthcare to be able to ask questions and to feel confident that this is something they are able to ask about. But I'm also passionate about educating our health professionals. And this is something we've been doing a lot of at the Austin and with other organisations as well, to actually teach health professionals about how to raise this topic and how to give people a chance to talk about the questions that they might have. So I would like to give you some tips, because I would love to say to you that you're going to be able to go to your health professional and they're going to ask you about if you have any sexual health and intimacy concerns. But unfortunately, I can't guarantee that right now because of all those reasons I described before. So here's some tips that might help you if you are wanting to raise this topic with a healthcare professional. First thing is, know this is an important healthcare issue. I know sometimes when you have cancer and you're being treated for that, it can feel like this health professional is providing treatment that's saving your life, and it's so vital, and it can feel like my sexuality and intimacy and those concerns aren't that important. But the thing is, they are important. Like we said before, it's such an important part of quality of life, and it's an important part of who you are. And this is the best place for you to be able to access good information and support. So it is an important health issue. Think about who you feel comfortable with. It might be your GP, might be your oncologist, it might be your nurse that you're seeing, it might be an OT, it might be a social worker. There's no wrong person to ask. Often people choose the person they feel most comfortable with. And if that person feels like they're not the right person, or that there's more information out there, they can help direct you, or they can actually help find that information for you as well. I know when you have a healthcare session, it can feel like there's a lot to get through in a very short amount of time. And often what I hear from healthcare professionals is that patients bring up questions around sex and intimacy as they're leaving the room. So everything's happened, they've had all their appointment, they're walking out the door and they're like, oh, by the way, I wanted to talk to you about sex. And the poor healthcare professional's like, I really want to have time to acknowledge this, but this is really hard when it's right at the end of the session. So sometimes flagging at the start of the session, saying like, I know we've got a lot to get to, but can we just put on the list that I've got a question about sex and intimacy? Can we make sure we talk about that as well? It can be really helpful. You might want to write down your questions. Sometimes, I know that it can feel you get a bit tongue-tied, especially when you feel like there's a bit of a pressure and time limited as well. So you can say, hey, I've got some questions here. I've written them down, and then the person can read your questions as well. And look, if the person you talk to doesn't give you the best response, I'm really sorry that happened. But it might be because they don't necessarily have the confidence, or maybe they're not the best person at that time. So please don't be put off. Speak to someone else, and even say to them, look, maybe if you're not the person, who else could I talk to about this? So here's some questions that there might be lots of questions that you have, but here's some general ones that you might be able to ask your healthcare provider. You can even before anything happens, you can just say, look, what sort of, am I likely to experience sexual problems with this treatment? What sort of things might happen? What have you heard about? What's common? And if this does happen, or it is happening, what can be done to treat it? Actually asking them broadly before the cancer treatment starts can be really good too, because then you go in prepared going, okay, I know that this might affect my libido, and I know that there's these supports out there if that happens. And then asking the healthcare providers, look, are there any resources that you know about, any support groups or services that can help me with sexual concerns? Because hopefully they've got a much broader view of what's out there and what's available. But like I said, talking about sex in general can be tricky, very tricky with healthcare providers, but also really tricky with our sexual partners. Which is surprising. We can be very physically intimate with people, but when it comes to putting words to what's happening, we can find that more challenging as well. One of the tips that I have, and this is not coming from me, but coming from many people who've worked in sexology and sexual medicine practices, is that often these conversations are best had out of the bedroom. They're best had at a time when you're feeling connected with someone and you're in a neutral space. So, maybe you've gone for a walk somewhere, maybe you're away for a weekend, but it's not in that moment in the bedroom. That's often a really kind of feels like it puts pressure on the conversation as well. And maybe, there's a chance to have a conversation with sexual partners that are quite broad. Okay, I'm going through this cancer treatment. It's going to change a lot about my body. I thought it would be good for us to have a chat about sex and intimacy. What does it mean in our relationship? What's important to us? And remembering about, well, what makes us feel connected? What feels pleasurable? Because often what I hear from couples when they come in to see me is they have an idea of what the other person thinks they should be doing, but they haven't actually spoken to that person about it. And often when we get two people together and we're talking about what makes them feel connected and what feels pleasurable, those activities are very able to be achieved, but we have this idea that that's not what the other person wants. And the really big one is to talk together about, well, what are we each worried about? What I think sometimes worries can very much get in the way from both sides. I hear a lot from partners of people who are going through cancer treatment, and the partners can feel like they're really scared about touching or being close to their partner because they don't want to cause pain and they don't want to cause stress. And they don't want to make their partner think that they want something more, that they're putting pressure on them. So what they do is they step back and they avoid. And the person who's going through cancer treatment feels more rejected potentially because there's that distance. And both people don't really talk about what they're worried about. So they don't get to share that. And they're starting to read into these behaviors in ways that aren't actually true. So something I talk a lot with clients about when they come to see me is that, okay, things might be really hard right now. You might be actively going through treatment, or you might be feeling very unwell. There might be a lot of nausea or pain and things like that. What are the activities that you can do for yourself, but also with your partners, that can help keep the pilot light burning? Now, for those of us that have had gas heaters, I think they're slowly going out of fashion. So maybe I'll have to change this analogy. But that feeling of like over summer, there's a little tiny pilot light. And it's there so that when it gets cold in winter, you can crank the heater and the flame takes off like that. And I think sometimes when we end up in this position of avoiding sex and intimacy and completely stepping away from our connection with ourselves and with our partners, that pilot light can go out and it can be quite hard to reignite that pilot light again. So we talk about, well, what are these pilot light activities? What are the things that keep the pilot light burning? They're the really small, really easy activities that we can do that can keep us connected with our body sensations and connected with our partners. And we'll talk through some of those things. So in terms of pleasure in the bedroom, we want to make sure that we're keeping that bedroom play fun and safe and positive and having that good communication and respect for boundaries, being really clear about what do we feel like right now, what do we don't feel like, and trying to keep away from that idea that it's in the bedroom is very disappointing and heavy and disheartening, and focused on, well, what can we do that feels nice and feels good right now? And how can we explore that closeness without pressure for more? There's lots of things like massaging and kissing and hand holding that are very, very accessible for people, even when there's lots of pain and nausea and fatigue going on. We can work out ways that we can experience touch that feel really nice. And when we've been, either exploring pleasure and touch with ourselves or with partners, after that, instead of kind of focusing on what we didn't do and what felt disappointing and hard and heavy, to actually kind of be patient and kind with ourselves and celebrate that we had that at that moment with ourselves or together. And counseling can be really, really helpful because there can be a lot of grief around this as well and a lot of processing that happens. So consider couples counseling or solo counseling, and consider talking to counselors as well about our feelings around sex and intimacy. So we talked about those pilot light activities, and here are 2 intimacy games that I think are absolutely fabulous. And these are things that I've recommended to many, many people. I'm not affiliated with either of them. I don't get any kind of, I wish I did, but I don't get any financial kickback from this. So the first one I want to talk to you about is the Betty Martin game on the left there. So Betty Martin is a sexologist in America. She's very famous, and she's been working in sex and intimacy and consent education for many, many years. There's a video on YouTube there that I've put the link through for that shows how to play a 3-minute game. Now, the summary of the 3-minute game is that it's really a nice way between partners to ask for touch and receive touch in a really short period of time. So you set a timer and you say to your partner, for the next 3 minutes, how I'd like you to touch me is like this. It might be a head massage, it might be a foot massage, it might be stroke my face, it might be for the next 3 minutes, I'd just like you to hold me. And if people are feeling like today I'm not quite connected to it and I don't want anyone touching me, maybe for the next 3 minutes, can you tell me about when you first met me and what you thought about me, or what you like most about me? And the beautiful thing about this is that it's only 3 minutes, and you can press a timer and you stop a timer as well. So it kind of gives you the ability to just relax into it as well. And you can play it in both directions. And it's such a small, bite-sized way to stay connected. And I think a lot of people it's kind of nice to have structured homework, especially at a time when there's lots of things going on. It's like, okay, Tuesdays and Thursdays in, the afternoon or in the morning, we're going to play the 3-minute game. There's another game that's like a little bit more, I guess, a bit more structured in a way, because it gives you more ideas of things that you can do. That's called the Yum card game. Now, this was produced by some fantastic Melbourne folk, and it's an intimacy game. And so it has cards that you can use to kind of, and it's the same idea of like there's a timer. So you might have a 2, 3, or 4 or 5-minute activity, and it provides you prompts of things that you might want to do for each other over those periods of time. And it's very much not about being sexual in a way that we might have prescribed before. Both of these games you can play with your clothes on, and they are very much kind of games about connecting you and your partner together again. I never recommend these activities unless they're things that I've tried myself personally, and both of them I find, even when I'm really tired, can be really lovely ways to just have a bite-sized way of reconnecting with my partner. It's also really important when we're thinking about, these activities, to also think about some kind of practical sides of things too. Like, what time of day are we thinking about reconnecting with partners or ourselves? What are our energy levels like? Where can we be comfortable and private, where does it feel warm? Where's the lighting nice? All of these things play into that sensory feeling of safety and wanting to be connected as well. Self-exploration in terms of self-touch, masturbation, having a lovely bubble bath, anything that's kind of bringing us into our body and sensations is part of sexuality and intimacy, and really kind of sets us up well in the future. Sometimes I speak to people who are kind of midway through cancer treatment and they're just about as far from anything in terms of masturbation or sexual activity as you could get, and they're just absolutely feeling devoid of that desire and sexual feelings. And we talk together and they're just like, oh, it's just gone, it's not there, it's this thing that I've lost and I can't even think about it at the moment. And we talk about that really small level of like, but can you sit outside in the sun today and feel the sun on your face, feel the breeze on your face? Because our bodies are very sensual, and if we can find activities where we're enjoying physical sensations, that's actually a pilot light activity that's going to help us when it comes back to being sexual later on as well, in a broader sense. But if we are engaging in more genital play and sexual activities, remembering that lubricants are your friend. Lubricants are not a sign of failure, that lubricants will make all sexual activities feel more fun and a lot nicer. Toys and aids can also be really great, particularly when people are tired and there's changes to sensation in genital tissue as well. Vibrators, really good for people with penises and people with clitorises too. That tissue really can respond to vibration, and it can be a really nice way to experience sexual arousal without having to use a lot of energy and effort as well. And kind of remembering that there are bringing novelty into sexuality as well can be really fun. Different types of clothing or books or imagery, visuals, videos, things like that as well. Kind of letting your brain explore what might be nice and what might be fun. I had a couple that I saw where they were, experiencing a lot of challenges due to cancer treatment, and one of them was feeling like they just didn't want to be touched at the moment, but they found that actually reading erotic poems together at night and holding hands gave them that sense of like, oh, we've got this sexiness going on that feels really nice for the two of us as well. And it kind of kept that going, as opposed to going, I can't be touched right now, that's off the cards, you go sleep in a different bedroom. Does that kind of make sense? Like, you can kind of have these activities. We're going back to that, sex is a whole buffet of experiences. And if one of them is reading erotic poems together, great, give that a go when that feels like it's working. In terms of lubricants and toys like vibrators, I cannot recommend this store, Passion Fruit, highly enough. Passion Fruit is a sensuality store. So I guess it's a sex store, but they've taken more of a sensuality approach. It's on Brunswick Street in Fitzroy, and they've got an online store as well. I'd really recommend going into this store and talking with some of the people there. Most of the people that work there either have a master's in sexology or public health. They are incredibly educated and really amazingly open-minded humans. And they see a lot of patients, particularly patients with cancer at the Austin, they often go to Passion Fruit to talk about different devices and lubricants as well. The manager of Passion Fruit is Australia's only lubologist. So she's done her, I think probably her PhD, I'm not sure, but she's done a lot of extensive training into lubes and what goes into lubes. And she helps people pick a lubricant that's going to work for them and make sure that that's not going to cause them any further problems as well. So fantastic store. They also offer one-on-one consults. So if you'd like to book a time with them one-on-one to go through different toy options, they'd be able to do that with you. And ultimately, this booklet is fabulous. It's a kind of one-stop shop for lots of things around sexuality, intimacy, and cancer. It's quite a thick booklet. There's lots to read there, but it can be really nice to kind of just pick bite-sized bits out of and have a look through. This book has recently been edited. So in the sexual health service I work at, we were part of editing it, but there were lots of people from many different disciplines editing this book and making sure that it's up to date and contains the best information that's out there. And the Cancer Council also offer nurse support and then also targeted counselling as well. I think they offer several free counselling sessions as well for people with cancer. So you can always call for support and talk to someone there about any concerns that you're experiencing as well. And two other fabulous books that have been written by Melbourne authors. I mean, Melbourne's fantastic at producing resources in this area. The one on the left, Dr. Amanda Horden, is a nurse by background who did her PhD in sexuality and intimacy and wrote this book for people who are experiencing challenges to sex and intimacy after cancer. And the one on the right, A Better Normal, is written by an OT in Melbourne called Tess, and Tess is someone who had cancer themselves, and Tess actually is also an OT. So Tess brought those two things together of being an OT and being a cancer patient and wrote what's called a better normal. And the idea behind this is that we're not creating just this new normal, like this is this new life that I've got and it doesn't feel as good as what it was before, but can we actually use this challenge of cancer and cancer treatments and these changes in conversations to actually create a better sex life maybe than we had before? There's lots of other resources out there, and I'm sure that these slides will be available afterwards, and this webinar is available for recording. But there's really lots of support, and I just kind of wanted to put this up there to give you that there is a broad range of supports out there, and once you do ask the question to healthcare professionals, you will be able to get, and you can also access these specific things yourself too. So I guess this is the message I wanted to leave with, is that sexuality and intimacy is so important to all of us, and it's such an individual and personal thing. And there's going to be grief about those changes. There's going to be a sadness that comes with what was before, and things are different now. But there comes a point too when there is an opportunity to see that there is the possibility to start a new life. And we do know that people are, there's been quite a lot of research in this area where they follow people who've had cancer for 5-10 years after treatment. And there's many, many people who are able to establish what they've described as an even more satisfying sexual life with themselves and with partners and after cancer treatment. So it's not, this is really bad and it's just going to get worse and that's it, but there is so much hope here. So thank you for listening. I want to give us time to have some questions. And I also want to give you the email address for the Sexual Health Service at the Austin. So my name's Simone, but there's two of us that work in this service. It's quite a small service. We're only 1 day a week each, so please forgive us if we take a bit of time to get back to your email. This service is available we can provide clinical consultations, and this is under public health, so it's free for Austin patients. If you're not an Austin patient, if you've never been to the Austin before, you can also get a GP referral through to our service, and we'll be able to see you on phone or telehealth, and we'll be able to discuss individual concerns that you have and direct you to specific resources, and even like talk through those games a little bit more in detail, and then set some homework and follow up on that as well. So thank you for listening. I'm going to stop sharing. Okay.
Thank you, Simone. That was really informative. And just before we do the move over to the questions, I'm just going to stop recording. So thank you very much.